Good afternoon, and thank you all for joining us. Today is Tuesday, August 31st, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin, and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and County Executive Crowley, I'll hand it over to you today.
Well, thank you so much, Catherine, and good afternoon to everyone. So this morning, it was an honor spending some time with Mayor Barrett, Governor Evers, Congresswoman Gwen Moore, and Senator Baldwin's staff, and many other elected officials and Milwaukee County leaders, particularly as we stood at the construction site where the new mental health emergency center is being built on 12th and Walnut. As I said it this morning, and it's worth noting again, I want to say again, thank you to Senator Tammy Baldwin and her team for not only understanding and believing in the importance of this project, but for taking action on this. She has requested $2.5 million to help with the construction of the mental health emergency center, and to her, we are extremely grateful. So again, I want to say thank you. This new mental health emergency center is a joint venture between Milwaukee County and the area's 4 health systems. That is Advocate Aurora Health, Ascension, Wisconsin, Children's Wisconsin, and Freighter Health. This new center will serve as a national model for emergency crisis care that is patient-centered, recovery-oriented, and culturally informed. We're going to offer 24/7 crisis mental health assessments, stabilization, treatment, and transition care management for children, adolescents, and adults. And this project is an important step forward and a needed resource in our community, as we know about mental health having only grown during the COVID-19 pandemic. And earlier this year, a Kaiser Family Foundation survey showed that 41% of adults reported symptoms of anxiety or depression. And suicide rates have long been on the rise and have worsened due to this pandemic. Often, one of the largest barriers to really receiving support is to know where you can go for help, which is why providing a center that offers easily accessible mental health specific services right in our community is so important. Our entire Milwaukee County team has worked tirelessly to build awareness for mental health and substance use disorder services throughout our community. And we're committed to investing in community-based resources that are more accessible to those who actually need them. But also, as we focus on equitable services as well as resources, so again, I want to thank Governor Evers for committing $19.5 million in ARPA funding to Milwaukee County to offset the 60% of the state transit aid that was eliminated in the 2021-2023 budget. Milwaukee County's budget was dramatically impacted by COVID-19 and the critical service that we need to keep running to serve our community. And transportation is extremely important. It's a very important resource that so many people rely on to get to their jobs, pick their kids up from school, visit family members, but also just to get around town and enjoy what we have to offer. So this is an investment in equity for our community. And this is the exact type of action that we need to continue to take if we want to see our families, our communities, and our economy get through this pandemic and really succeed for years to come. So creating more transportation options and resources for residents is just one way that we can break down these barriers and really encourage more connected communities that have historically been divided, as well as create thriving neighborhoods that are welcoming to everyone. Both mental health and transportation, these are key social determinants of health, and they are key services, essential services that have been strained during the COVID-19 pandemic. And so we as Milwaukee County, we are committed to using our ARPA funds to invest in solutions and as well as policies upstream that create a more equitable distribution of resources for all of our residents. And lastly, I just want to continue to remind folks that they have until Labor Day to get their COVID-19 vaccine from a Wisconsin healthcare provider, and they'll receive a $100 gift card. This applies to residents ages 12 or older. And so if you're interested and would like more information on this reward program, please visit the DHS $100 reward page. And you can visit it by visiting 100.wisconsin.gov. Again, 100.wisconsin.gov, or you can call 844-684-1064. Again, that number is 844-684-1064, and language assistance is available for those who need it. So thank you again for joining us this afternoon. And with that, I'll hand it over to Mayor Barrett. Mayor Barrett.
Well, thank you very much, County Executive Crowley, and I want to congratulate you again. I thought that the event earlier today, to signify the major partnership that has occurred among the four healthcare systems, the county, the state, the city, to ensure that we have an emergency medical treatment center for mental health issues in the city of Milwaukee is an incredibly important step forward. And it's, as one of the speakers said this morning, he felt that it was the most significant step taken in the last 30 years in this community to deal with mental health on an emergency basis. And I want to start with that because it's important and it's obviously newsworthy, but it also ties into the first two issues that I think we also have to talk about today in conjunction with the pandemic. We've spent a lot of time, rightfully so, talking about the very, very serious healthcare challenges that we've seen. We know that the deaths are rising. We know hospitalizations are up because of COVID-19. We spent a lot of time talking about prevention, whether it's vaccinations, whether it's masks, whether it's social distancing. And all of those issues are incredibly, incredibly important. But there are several other issues that are also important. We've talked a lot about the economic issues. We've talked about the impact on businesses. But I think it's also important that we focus on some of the mental health aspects of this pandemic as well. And I'd like to take a moment to talk about the COVID-19 virus and its continued impact on people's mental health and well-being. And this is an appropriate time to do it because September is Suicide Prevention Month. We know that social isolation and loneliness exacerbates and worsens symptoms of mental illness. And if untreated, mental health issues can lead to suicidal thoughts or even actions. We know that. And we know that for a number of individuals, it has been a far more isolating year than we've ever had in our lives. Research has shown a connection between job loss and increased depression, anxiety, distress, and an increase in substance abuse and suicide. We also know, again, because of the pandemic, that many individuals have been forced to isolate. And again, that can lead to problems for individuals. So please seek resources if you are experiencing any of these symptoms. Consider speaking with a therapist, either in person or using teletherapy. Establish a self-care routine to reduce the physical signs of stress. This includes healthy eating and exercise. Monitor alcohol and substance abuse and speak with a financial counselor. We know that that can cause pressures as well. And we're pleased that we've got free support available through the Financial Navigators Program in both Spanish and English. So call 414-882-7440 or visit milwaukee.gov/FN for the financial support. But whether it's issues that have come as a result of the pandemic or issues you're facing in your daily life, it's important for us to have these resources available. A corollary to this, the suicide, of course, is, and another difficult topic that deserves special attention, is the problem of increased substance abuse in response to the pandemic. Again, this is a timely time to talk about it because today is International Overdose Awareness Day, a day to bring attention to and reduce the stigma of drug-related death. Unfortunately, here in Milwaukee, we have seen literally an explosion over the last decade or two in overdoses. Milwaukee County experienced a record high of 546 people who lost their lives to overdose this past year, with more than 1,500 lost in Wisconsin. These numbers are a result of the availability of the ultra-potent synthetic opioid fentanyl and social isolation caused by the pandemic. The Milwaukee County Substance Abuse Prevention Coalition hosted a public memorial at Zyla Union Square today to honor the lives of those individuals lost to overdose, supporting individuals and families coping with substance abuse and grief and other prevention resources. The Milwaukee Overdose Response Initiative, which is a partnership between the city, the county, community organizations, health departments, and the fire department, also works to address this issue in our community. One of our key partners has been our fire department. And I think that surprises a lot of people when they realize just how engaged our fire department has been on that. But utilizing opioid-related overdose data from the fire department, a rapid response by a trained community paramedic and peer support specialist is used to engage clients in treatment and recovery services following an overdose. This happens because the fire department, not surprisingly, is a first responder in these opioid calls. So it sees firsthand really the lost lives, the crushed families as a result of opioid overdoses. Now to shift gears and go directly to our COVID numbers, we remain in the extreme transmission category for COVID-19 cases per 100,000. We're up to 244.7 per 100,000. We are not happy to be at that number. Our percent positivity remains in the substantial transmission category, up to 9.3%. These slight increases bring us to the highest value for our case burden since January of this year. And keep in mind, that's, I think in large part, we know that there are some breakthrough cases or breakout cases, but a lot of these are going to be individuals who did not get the vaccination. So let's talk about our vaccination rates. 53.2% of city of Milwaukee adults, individuals 16 or older, are fully vaccinated. And 58.5% of adults have received at least one dose. So we have to do better in those categories. So please do your part to help drive down these numbers. Mitigation measures like wearing a mask, washing your hands, and washing your distance remain useful tools to stop the spread of the virus. But we all know that getting the vaccination is by far the most effective way to protect yourself and your loved ones and anyone you come in contact with. And even if you get the disease again, we know that it historically has not been as severe if you've gotten the vaccination. So in addition to community testing locations at the North Side and South Side health centers, this week there are multiple opportunities available to you in the community. At MATC's Walker Square today from 3 to 6 p.m., Schlitz Park for Milwaukee Downtown Appreciation Week tomorrow from 11 a.m. to 2 p.m. The UWM Library on Wednesday and Thursday from 2 to 6 p.m. And unfortunately, in observance of the weekend, there will not be any mobile clinics taking place September 3rd through 6th. So just be aware of that as well. This past weekend, the Milwaukee Health Department was involved in a variety of community events providing vaccinations. At Mexican Fiesta, over 80 vaccinations were administered, and an additional 30 vaccinations were administered at other community events, such as the MPS Run Back to School. The health department also continues its door-to-door efforts, which is really yeoman's efforts. I want to thank those individuals who are doing that. And they're working in those areas with low vaccination rates. They're offering education, dialogue, and on-the-spot vaccination for residents. To date, 545 vaccinations have been administered through this effort. And as an added plus, 584 smoke detectors have been installed in homes by members of the fire department. So again, our fire department's a critical partner in all that we are doing. And with that, I will turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 268 new cases per day and about 3 deaths per day. Our cases seem to have plateaued over the last few weeks and continue to remain stable. Unfortunately, our hospitalizations continue to increase. We're now up to 243 individuals hospitalized with COVID in the county. And that's the highest number we've seen since early in January. Increasing hospitalizations coupled with staffing shortages is not a good combination. Meanwhile, vaccination rates remain stable, just below 1,000 people seeking out first dose of vaccine per day. So today I wanted to try to address a few persistent areas of vaccine misinformation or myths. First, unfortunately, the myth of the vaccine containing a tracking microchip seems to have persisted. Now, this may seem like a fringe conspiracy theory, something not even worth taking the time to talk about. However, just a month ago, there's a survey from The Economist and YouGov that found that 20% of people in this country believe that the government is using the COVID-19 vaccine to microchip people. That's 1 in 5 people that believe that. So understanding that these may be difficult minds to change, we can at least try to address it. Now, much like many conspiracy theories, this one comes from a nugget of truth. So the Gates Foundation in late 2019 supported research, as they do much research, to place a small kind of a tattoo of sorts on the skin of people when they get vaccinated. So this would be invisible to the naked eye, but when viewed with a special light, you could tell whether or not that person had received a vaccine. You can imagine the benefits of that sort of a system in a low-income country, for example, that doesn't have electronic medical records. Now, of course, there were no microchips involved. There was no tracking involved. But that's become twisted in many corners of the internet to the microchip conspiracy theory we hear about today. Now, there's so many ways to put this theory to rest. First, anyone wondering what exactly is contained in the vaccines can find that. The CDC, the FDA, the manufacturers, they all provide very specific lists of ingredients, both active and inactive, of what's in the vaccines. And moreover, there does not exist such a microchip with tracking capabilities that could fit through a needle and be injected into our bodies. If there were, that would be a company to invest in because there's many more uses than secretly tracking your whereabouts. And finally, one need just imagine the vast conspiracy that would have to take place for this to happen from our government, every government in the world, manufacturers, researchers, doctors, frankly, anyone who owns a microscope would have to be in on the secret. So conspiracy theories are certainly entertaining to think about. They're fun to watch in movies, but they shouldn't have to risk the lives of millions of unvaccinated Americans. Now, next up on the list of misunderstandings and myths is the Vares death data. So Vares, VAERS, is the CDC's vaccine adverse event reporting system. This is an open database, so anyone can submit adverse events that may be related to the vaccine. Healthcare providers are required to submit adverse events, and members of the public can certainly submit as well. There's an online submission form. Now, where the misinformation has come in is with VAERS reporting deaths among people who've received the COVID vaccine. So there's been about 7,000 deaths that have been reported in this way. It's important to keep in mind because of the openness of reporting in this system and the fact that healthcare providers must enter deaths even if they don't think that they're related to the vaccine for the CDC to review and understand. So having a death listed there does not mean that it was caused by the vaccine. Now, in fact, the CDC and partner organizations investigate every one of those reported deaths to see if it indeed was caused by the vaccine. And for the mRNA vaccines, not one person has been found to die from the vaccine. Now, you can also look at this on the population level rather than the individual level. So to take this, basically you take 1 million people who've received the vaccine and you compare that rate of deaths in that group to what you'd expect among 1 million people in the general population. And that's also been done multiple times. So for example, you look at the overall population. So 7,000 people have been reported as dying with some time association to getting the vaccine. That's out of 200 million people that received it. So you calculate that out, it's about 0.0034% of that population. So now you'd want to compare that to the expected level of death in the general population. So you take a similar period of time in 2019 before COVID, and the death rate of the general population was about 0.0058. So 0.0034 for vaccinated, 0.0058 for general population. So in fact, the death rate among those vaccinated is actually lower than you would expect in the general population. All this is to say that you have to be careful about drawing causation from these numbers. So as an analogy, we may find that in the last year, 1,000 people who drove green cars died of a heart attack. Now that may well be true, but the green cars had nothing to do with their heart attack. And likewise, the 7,000 reported deaths in the Vares system sure seem, by many reputable studies, to have nothing to do with the vaccine. Now, third is the idea that the vaccine is experimental. We hear this a lot. Now, let's be clear. The vaccines have been out for about a year now. They've been given to 200 million people in the United States, and more than 5 billion doses of vaccine have been given globally. Now, you'd be hard-pressed to find a medication or certainly a vaccine that's been administered that broadly, and certainly that's been as closely studied as these vaccines have. Now, add to that the fact that vaccines are not like most medications. They're not taken every day, lasting in your body and potentially making changes over time. They enter our body, they do their job, and then they leave. That's why adverse effects of vaccines are, based on all of our experience with past vaccines, they're seen within 6 to 8 weeks of administration of the vaccine. And that is why when the FDA followed the same process that they do for any other medication or any other vaccine, they recently issued the full approval to the Pfizer vaccine. So what can you do with this information? Well, you can use it to combat misinformation. Next time someone tells you that they think there's a microchip in the vaccine, tell them where that conspiracy came from and that it's just not physically possible. When someone tells you about the deaths from the vaccine, explain that there has not been a single death associated with the mRNA vaccines. And when 200 million people do anything, like driving a green car, bad things happen. But it's not due to the green car and it's not due to the vaccine. And when someone tells you the vaccine is experimental, tell them that not only is it approved by the FDA, but it's one of the most widely administered and studied vaccines in history. That's all to say, help spread accurate information, not misinformation. Misinformation and conspiracy theories are widespread and can be overwhelming to confront and correct. But we can do it one person at a time. It'll make that person and our community healthier. Thank you and stay safe, and I'll hand it to Health Officer Rausch.
Thank you very much, Dr. Weston. It's my pleasure to join today to give a little bit more of an update on the data associated with the COVID pandemic and the ongoing vaccination efforts. So both Mayor Barrett and Dr. Weston did a great job of putting into context where we sit currently in the pandemic and some of the risks and misconceptions about the COVID vaccination. I just want to echo their comments and continue to say that COVID-19 is still very active in our community. And while cases have plateaued in recent days, the 7-day case averages are still very high and very consistent to what we saw back in January. An ongoing theme that we've talked about in recent weeks too is how many cases are occurring in our kids, because we know that the Delta variant is more transmissible, and we have seen an increasing proportion of our cases amongst kids 18 years of age and younger. So specifically for the most recent week of data, 1/4 of our cases in Milwaukee County have occurred amongst those children 18 years of age and under. In prior weeks, that number was just a little bit higher than 20%. So the increase to 25% may likely be within statistical expectations, but it is a key consideration as we consider where COVID pandemic or the COVID pandemic will go in the next several weeks. Remember, a few weeks ago, some MPS schools have opened. We know some private and parochial schools have opened in the last few weeks and even earlier this week. But we know a large number of schools are opening tomorrow on Wednesday, September 1st. And so we will start to expect additional cases of COVID-19 in kids with more mixing and mingling of kids in school settings. So this is something to keep in mind as we go forward in the next couple weeks. There still is transmission, and it still certainly is concerning as we head into the school year. So with the start of the school year, for the majority of students, there are several important messages that I want to share today about prevention, about getting tested, as well as isolation and quarantine protocols for students. So first of all, let's start with prevention. We certainly know, kind of in the guise of mental health and anxiety and worries, we know that many parents are concerned about these things, and they're certainly concerned as we head into the school year. So first of all, parents can really help their kids, first of all, through vaccination. If your kid is eligible for vaccination, get your child vaccinated. This is the best prevention. And we know that COVID-19 vaccines can be given simultaneously with other childhood vaccines. So many parents have already been taking advantage of this by getting those routine back to school vaccines, tetanus, some of the other vaccines alongside COVID-19. Secondly, we know in public settings that wearing a mask or a face covering is always the best choice. And certainly it has been frustrating for both parents and public health professionals that schools have not always been following that guidance. Many schools have been following that guidance. So in any event, parents can still continue to make that choice and find the right decision for their family. And lastly, something that can prevent disease is reminding your kid about coughing and sneezing into their elbow, using hand washing and hand sanitizer whenever possible to decrease the transmission of germs in the school setting. Now, thinking about testing, we know there's a lot of testing opportunities available throughout Milwaukee County, and getting tested is something that should be done if your child develops symptoms. So think about those symptoms of COVID that we've been talking about over the past 18 months. Fever, chills, shortness of breath, fatigue, congestion, sore throat, new loss of taste or smell. These symptoms, while they may be similar to other viruses and other colds, it is important in the context of the COVID-19 pandemic to consider these as options and get testing to rule out COVID-19. As I mentioned, Healthy MKE and other sites can help you find a testing option for yourself or for your child. Now, if your child tests positive, they will be isolated. And a case investigation will occur to determine whether or not they exposed others at school, daycare, within the family. And if your child is isolated, they will be able to return to school 10 days after symptoms have started, provided that they haven't had a fever for the last 24 hours and their symptoms have improved. And in another setting, whether it's in school, sports teams, family, etc., if your child is exposed to COVID-19 by someone else, they will be quarantined if they're determined to have close contact. And remember, the definition of close contact is generally looking at a close contact within 6 feet for 15 or more minutes in a 24-hour period. So the quarantine period is really a period where we know somebody's been exposed and we want to separate that exposed person from the general public so that disease isn't continually transmitted. We want to use that quarantine period as an opportunity to interrupt disease transmission. And so the quarantine period will generally last a minimum of 7 days, and it will require a negative test to leave quarantine. And that negative test will generally be collected either on day 6 or day 7 for release to school, release to daycare, release to work. And these details will be part of the case investigation that's conducted by school staff, typically the school nurse and or public health staff working in conjunction with the family during case investigation. So that is the end of my prepared remarks today. I'll now turn the briefing back to Catherine for the question and answer portion.
Thank you, Director Rausch. We have several questions in the chat. The first coming from Gabriela Bachara with CBS 58. Perhaps it's for Dr. Weston. She's wondering, have we reached the point where Wisconsin hospitals need to turn away patients? How is the nationwide nursing shortage directly impacting our hospitals, and are you concerned?
Yeah, thanks for the question. We haven't reached the point where we're turning away patients, but certainly the combination of increasing numbers of patients being hospitalized, in particular for COVID, and decreasing number of staff able to care for those patients is a dangerous direction to be going. We see nursing shortages across the country, but we're certainly feeling them in Wisconsin. I think the reasons for that include certainly burnout. It's been a challenging time for healthcare providers over the last 18 months for all sorts of reasons that we've talked about. Because of that burnout, there's a shortage, which leads to nurses often and other providers leaving for other areas with higher pay. And then without a doubt, we're seeing quite a few healthcare providers still out on quarantine and on isolation due to COVID. And so each of those three reasons are leading to nursing shortages.
The next question comes from Ben Wagner with WISN 12. Perhaps again, Dr. Weston, you're able to jump in on this. He's asking, ICU beds at hospitals in northern Wisconsin are nearly full. What is the ICU bed situation like in southeastern Wisconsin? And are these patients mostly or all unvaccinated? And how does this affect patient care?
So in southeastern Wisconsin, we are lucky to have a number of large health systems, large hospitals. So right now we're at about 85% ICU capacity. Now for our floor beds, our more standard beds, it's higher. We're about 95% capacity for floor beds. As far as patients hospitalized, we see studies from across the country. We see reports from across the country. They range as far as what percentage of patients hospitalized tend to be unvaccinated. But in most states, it ranges from about 95 up to 99% of patients who are in the hospital with COVID being unvaccinated.
Our next few questions are for Mayor Barrett, and they come from Allison Durr with the Milwaukee Journal-Sentinel. She says, Mayor Barrett, how many city employees have registered their vaccination status with the city ahead of the September 1st deadline? And what is that breakdown so far between those who have not been vaccinated and those who have? And what is likely causing cases to plateau? Which maybe is a separate question.
Well, we don't have the numbers yet, but as soon as we have those numbers, we'll make those numbers available to you. People obviously are right now in the process of registering, but we'll have those numbers. And just yesterday, there was a number of meetings going on just to work out the logistics of the program. So we'll get you those numbers when they become available. And maybe Dr. Weston wants to talk about the plateau issue. He's probably better suited for that.
Sure. I mean, frankly, the plateau is interesting. We haven't had a plateau like this 3 or 4 weeks of fairly consistent case numbers. We haven't seen this before in the pandemic. Of course, the question is, from the plateau, does it go up or does it go down? We all certainly hope it goes down. We did see in the state an increase in cases over the last few days after a bit of a plateau. Milwaukee County doesn't seem to be caught up to that yet. Hopefully we won't, but that would suggest that we may see an increase in cases as well. And then certainly there's a number of warning signs in the weeks and months ahead. As Health Officer Roush mentioned, back to school is going to be a challenge. This is not the same school year that we had last year. The Delta variant is extremely different from the virus that we were dealing with a year ago. In addition, we have colder weather coming up, more indoor gatherings, and the virus we know is more likely to spread indoors. And then on a national level, we certainly don't see trends going downward, but we'll remain hopeful and keep a close eye on it and hope that that plateau starts coming downward, but be cautious that it might go back up.
Thank you. The next question is for Director Roush from Chuck Kornbach with WUWM. He's wondering what percentage of Milwaukee County teens have been vaccinated?
Great question. I'm going to answer that first, and then I'll show the graphic that we have from last week's vaccination report. But as I look at the numbers, the 12 to 15-year-old age group is completely vaccinated at a rate of about 32%. So just under 1/3 of our 12 to 15-year-olds are fully vaccinated. The next age group, if we look at the 16 to 17-year-old age group, that age group is vaccinated at about a 41% clip. So about 4 out of 10 of the 16 to 17-year-olds in Milwaukee County have been completely vaccinated. And the numbers go up a little bit after that, but certainly I think Chuck's question is focused on high school and middle school students. And if I share my screen here, I'll give you a look at what this looks like across all age groups. Again, as I mentioned previously, vaccination is the goal here, because that is what's going to help us get out of the pandemic. That's what's going to help us quash the Delta variant and other future variants. So we see a pretty marked increase across all age groups in this vaccination report. But certainly we see since early June, when it became eligible, the vaccine became eligible to 12 to 15s, a pretty marked increase to about that 32% mark, 41% for our next population. And it goes up from there to about 46% for the young adults, the 18 to 24s. So these rates still aren't where we need to be for community immunity or building that herd immunity, because we'd much rather see it here at the 80% mark, like we are for our 60 to 79. But even at 70%, where our 80 plus population is, we need to get those vaccination numbers up. Good news is that these rates continue to increase, but certainly there's some room for improvement across all age groups, except for some of our oldest age groups.
As we're focusing on our youth, I'll just jump over to Rebecca Clough with TMJ4. She's got 2 questions. As students return to school at MPS, most of the COVID cases are being driven by high school students. First, is the county data seeing the same thing with increasing cases in 19 to 18-year-olds?
So when we look across the county at our positivity rates, they're highest in 3 of our age groups. We break them down by school age. So grade school, middle school, and high school seem to be some of the highest positivity rates in the county. So when you do pre-K, 0 to 4 years old, positivity rates are lower. And actually among the college age groups, they seem to be coming down a little bit. But middle school is our highest. So that's your 12 to 13-year-olds. We're at 19.1% positivity. High school is at about 17% and grade school at 16%. So certainly above the average that we're seeing in the county. and that suggests caution in going back to school. The importance of mask use, the importance of distancing, the importance of ventilation.
And the second part of Rebecca's question is, with high school students able to be vaccinated, is there any plan to offer vaccines in schools?
Director Roush may have more information specific to districts. I think different schools have different plans throughout the county right now.
Yeah, I mean, vaccinations have been available for many, many months now. I know a number of health departments offered vaccine clinics in association with schools or in partnerships with schools back in the spring. I certainly know we've continued to outreach our local schools, and information has been shared widely with school families and school parents. I'm not aware of anything specifically now, but certainly there are many opportunities for vaccination, including walking into pharmacies. Generally speaking, you can walk in or call and make same-day appointments in many health departments. So there's a lot of opportunities out there as well.
And the final question I'm seeing in the chat right now comes from Fox 6. They're asking, with Milwaukee County in the extreme transmission category, are there any concerns about Summerfest and any advice to people who may be attending?
Mr. Mayor, would you like to start?
I'm trying to get my video going here. Maybe I'll start without my video. The video is not going back on, but I'd be happy to. First of all, I'm very pleased with the efforts that Summerfest has taken. I think it's taken a responsible approach with the vaccination or the proof of a negative finding. I think that that's an appropriate way to move forward. At the same time, I think people should remain concerned. And as Dr. Weston and Director Roush have said, the Delta variant is a much more serious spreader of the disease. All the diseases is very, very dangerous, but this is obviously a more prolific spreader. So, but I am pleased that they have the vaccination requirement in place. I think that's very responsible.
I would agree completely. I think, much like any other event, it's about the layers of protection. Summerfest has added a very important layer, being the vaccine or testing requirement. Now, on top of that, it's a generally outdoor event. That makes it a lot safer. But nonetheless, it is an event where people are together in groups, and we know that's how COVID spreads. So keep adding on the layers, distancing, masking, as well as vaccine and being outdoors.
Well, thank you all. Those are the questions I'm seeing in the chat. So thank you, media, for asking questions. Thank you all for being here, and we'll see you all next week.
Thank you very much.
Thanks, everybody.
Thank you.